Dr. Pragna Shetty from Cloud9. I am also available at Nexus Care, Nerul and Seawoods. Today's topic of discussion is azoospermia. So what is azoospermia? Azoospermia is a condition where semen is secreted in a man, but when you look under microscope, there are no sperms that are seen in the semen. So how do we label a person as azoospermia? Not just one sample, there should be 2 samples that has to be examined in andrology lab, and both the samples shows no sperms. Then only we can label a person as azoospermic. So how frequent is this condition in a man? It is very rare condition. So when you take 100 normal men, only 1% in 100, that is 1%, will be having azoospermia. But when you see at the infertile men who are not able to conceive, then the incidence is slightly higher, that is 10 to 15%. That means when you look at 100 infertile men, 10 or 15 infertile men may have azoospermia. So what are the causes? Coming to why does it happen? The reason could be 3. One is something to do with your testes. So there may be genetically abnormal, so that is why it is not producing the sperm, or there are some infection in your lifetime, whether it is in the adolescence or in the childhood, that has damaged your testes and hence the sperms are not secreting. The other reason could be the hormonal abnormalities. There are certain hormones involved in the sperm production, and if it is not secreting properly, then it could lead to azoospermia. The third cause is blockage. That means the sperms are secreting in your body, but then it is not coming out because there is some blockage because of genetic or because of infection. Okay, so these are the reasons for azoospermia. Now the next step is, how do we diagnose it? Okay, once we have confirmed azoospermia, what is the next step? The next step is to know what is causing it. What are the list that you have just mentioned. So we will be doing the test to rule out what are the causes of azoospermia. So we'll do a blood test where we will check for the hormones. We'll do the scan of the testes, and then we'll be looking at the genetic test. So this will help us study what is causing azoospermia. If genetic cause is the reason that is affecting your testes and causing azoospermia, and sperms are still secreting in your body, there are certain conditions like Y chromosome microdeletion or CFDR gene mutation. If these are the genetic abnormalities that is there in your body, then we will not be using your sperms for doing IVF, because the genetic offspring that is coming, the baby that is coming, will also be will also be having these diseases. So that has to be ruled out before using your sperm. So as I said before, what next? Now we have diagnosed this. What next? What is the treatment? The treatment depends on 2 things, that is whether the sperm is secreted in your body or not. In condition where the sperm is secreted in your body but there is a blockage, and because of which the sperm is not coming out, the treatment option would be aspiration. We put a needle in your sperm, aspirate the sperm, and using that we'll do an IVF, and we will give you your genetically born baby after ruling out any other genetic problems that is there in you. And the second scenario is when the sperms are not secreted in your body. Then we will look at whether the hormones are normal or not. If the hormones are reduced, we'll try to give the injections. With that, if the sperm is being secreted, then we'll use that sperm, do IVF and have a baby. And if the sperms are not secreted in your body and the hormones are normal, then we cannot do anything. In that scenario, we will be using, or we will be giving you the option of donor sperms for the fertility, as a fertility option. So to summarize, azoospermia is a rare condition. Okay, so once it is there, once it is being diagnosed, it is not always donor. Okay, so there are opportunities for you to get your own genetically born baby. Okay, when in less than 10% or when the sperms are not secreted, only then the donor sperm is the treatment of choice for you. So, good luck with your fertility journey. I hope this knowledge will reduce your anxiety and help you seek treatment at the right time. Thank you.